acne scars be treated? Acne scars can present in different ways, so the first step is actually identifying the type. We usually classify them as firstly atrophic scars, so they're your ice pick, your boxcar, or your rolling scars. And then we've got hypertrophic or keloid scars, which is where you get raised or firm scars. Lastly, we've got post-inflammatory pigmentation or erythema, which is where you get color changes to your skin after acne. There are several treatment options, often used in combination depending on your skin type and also your scar pattern. Firstly, we've got fractional lasers such as CO2 or erbium, and they resurface the skin and stimulate collagen to support scar remodeling. We also use polynucleotide injections such as S, which are designed to boost collagen and support your skin healing. Our next option is microneedling, which creates controlled microchannels to stimulate new collagen. And if you've got rolling scars, doctors can sometimes use subcision, where a fine needle is used to release the fibrous bands beneath the scars, allowing the skin above to lift up. And lastly, doctor-only steroid injections can be used for raised scars, which may help to flatten hypertrophic or your keloid scars. Most treatment plans involve a series of sessions, typically spaced several weeks apart, with improvements developing gradually over time. Both your skin type and scar pattern guide the choice of treatments, and acne scar management is rarely a single procedure. It's a personalized plan using a combination of technologies over time.